Oh, hi everyone, and welcome to the Vira Health Conversations. I'm your host, Irma Rastigaiva.
And Evan Kirstel here.
Today, we're diving into the future of cancer care with Dan Nardi, CEO of Reimagine Care. His company is taking cancer treatment out of the hospital and into patients' homes using tech, AI, and a whole lot of humanity. We'll explore what that means for patients, providers, and the healthcare system at large. And right off the bat, I want to disclose my particular interest in this topic as a long-term patient advocate, including for patients with cancer, and myself as a cancer survivor. This could not be more interesting and important in my eyes. So, Dan, welcome. Welcome to the pod.
Thank you so much for having me, Irma, and thank you for sharing your story and all the work you do as an advocate. Very important.
Thank you, of course. And Dan, can we start by talking a little bit about your background, how you came to Reimagine Care, and how do you, show up in this world of cancer care? What's your backstory?
Yeah, it's a great question. So I actually kind of lucked into healthcare a very long time ago. I was more on the technology side of it, math and computer science, and kind of ended up in the early days of electronic medical records. But more recently, last 11 years or so, I've been very lucky to have the opportunity to be building businesses, so more on the startup and growth stage side of healthcare. And so, let's see, it was Livongo. So I joined early days at Livongo and helped build that from 13 employees to up until the IPO. And then more recently was COO at Carum Health, a two-sided marketplace for centers of excellence and employer benefits. And then the team at Reimagine Care came and found me as they were thinking about the next stage of growth. And so I've been now on board for over 2 years and very excited for the impact we have. But, based on your question earlier, kind of a lot of healthcare startups or just healthcare in general you either come from more of the clinical side or more of the technology side. And I'm from the latter. So
Brilliant. And you talk about taking cancer care home. So in simple terms, how do you change the way cancer patients get treated at home instead of, or in addition to, in the hospital?
Yeah, so currently we partner with oncology clinics around the country. So everything from academic medical centers like City of Hope and Moffitt to community hospitals, Memorial Hermann and others, and then independent practices as well. And what we do is we become an extension of their care. So it's not necessarily the actual treatment that we're moving into the home, but we're there to help support them 24/7, 365, really filling the gap, for that 97, 98% of the cancer journey that happens outside of the four walls of the clinic, right? Like a lot of healthcare, oncologists and the clinical teams are wonderful when the patients are there in person, in front of them, able to help support them. But like a lot of healthcare, as soon as the patients walk out that door, we lose that ability to support them with real answers and high quality support, within seconds. And that's really what we provide. And so we become an extension of that cancer team and supporting patients all day.
Wow.
Yeah, and as you basically alluded to, cancer care in general is a very complex, issue, and it involves a lot of moving parts. So one of the approaches you have is the virtual assistant called Remy. So my understanding is that it's just a text-based communication tool. So why did you go such a simple route instead of, another maybe app with a lot of bells and whistles?
Yeah, so during the early days, we did a lot of evaluation of which route did we want to go. The app route, the text route, phone call route, there's all different options. And at the end of the day, we chose text as the lowest barrier to entry. So the vast majority of the population has phones that are able to text nowadays. And we chose that because we didn't want to have to deal with the complexities of apps with versioning and passwords and everything that goes along with that. That's a whole additional level of complexity that brings for patients already going through a challenging time. And another reason is because, a lot of cases we're white labeled. So we actually offer that as our default implementation method. Is again, we don't want to introduce a new name, a new challenge, a new hurdle for patients going through an already challenging time. So we're interacting with patients on behalf of City of Hope, on behalf of Memorial Hermann. And from a patient experience, it helps be more seamless as an extension of their cancer team. So that was but it was a very important decision that we made early on, Irma, and I think that was an extremely beneficial one for what's played out. As we've talked with others that have created healthcare apps, we found that, yeah, they might get a lot of downloads, but there's not a lot of engagement. There's not a lot of usage of those, whereas we actually have very high engagement. High enrollment, high engagement, 90+%, even out 3 to 6 months at all age demographics. That's the funny thing. So again, initial default reaction is like, oh, so it might work for the younger populations, but maybe not for older populations. We actually see the 65 and older demographic is actually one of the most engaged. When you get the 4, 5, 6 months out, they found that connectivity. They found that outlet for quick answers, quick support. And so again, it's kind of proved out that decision that we made several years ago. And we're really, really pleased with those engagement numbers.
Brilliant. And how do you decide how and when to make the switch from, AI, from the chatbot to a human being and vice versa? That's a complex balancing act.
Very complex. And that's the secret sauce really of what we do, is the combination of technology with our amazing virtual care center, our team of remote oncology trained RNs and MAs, because you can't just solve this problem with technology, right? Just like we can't just solve this problem with throwing bodies at it either, right? We've got this growing divide of supply and demand in healthcare in general, not only in cancer care. And so we have patients that are being diagnosed earlier and younger in life. We have treatments that have improved. That's a great thing, right? So that means patients are living longer on treatment. So you have this drastic increase in the demand of cancer care. On the supply side, we already have a shortage of oncologists, as we know. There's burnout. And so again, it's that combination of technology, at the right moment. And we like to call Remy's like our little superhero, right? It's like our digital front door. And it does a lot of the heavy lifting. Remy can resolve over 50%. So we have thousands of interactions with patients every single month. Remy is resolving over 50% of them on its own, right? So you talk about scalability. But for that other 50%, that's that thoughtful handoff at the right moment. And because we've built in those right guardrails, right? This isn't, you're not talking to ChatGPT or Grok and all these generative AI agents, agentic AI agents, like it's improving so quickly, right? And we're working towards that, but you can't let an agent like that loose on a patient population for cancer, let alone any part of healthcare, but especially for cancer. And so we've got the right guardrails around it and really supporting it. So as we're working our patients through these pathways, right, clinical best practices and the pathways we built, it knows, depending on the answers, when to bubble it up, when to escalate that to our care team. And again, because we have a team of MAs, RNs, and APPs, we can get it to the right person in the right moment. So think about kind of shortcutting that whole triage process. So within seconds, a patient can be interacting with Remy. Within minutes, we can have them connected to the right person, the right level of care if they need to talk to a human. And when you compare that to the status quo right now for organizations, for clinics that are doing wonderful work, but if they're just not staffed appropriately, the default right now is you're going to call into, your oncologist, if it's evenings, weekends, middle of the day, you're going to get a voicemail. We appreciate your call. Thank you so much. We'll give you a call back. You'll receive a call back in 24 to 72 hours. That's the default we're hearing. Well, it's that. Or what we can do is like, you're actually talking to someone within seconds and minutes. Like that's what we're helping to improve, is that connective tissue between the patient back to the clinical team, all within seconds and minutes.
Oh, I love that approach. This is really hitting home. Now, about choosing the right partner. So obviously you work with some big names in healthcare. What do you look for in a partner? And can you give us some recent examples of successes, what really worked well, perhaps what you've learned by working with different partners?
Yeah, I think the important part is, this is something we talk about internally a lot. We're always learning, right? We're having a growth mindset, having a learning mindset, right? We have to always be learning how we can be improving our product, how we can be improving our team, how we can be improving our own kind of personal impact on what we're doing every single day. So having a learning mentality is extremely important to us. And so we've iterated now and launched with numerous health systems, all different shapes and sizes and different geographies. And every single time we learn something, right? We learn like, what can we take back from that experience? Most recently was Moffitt. We've now been live for several months. Some of the early numbers with Moffitt are very impactful, right? And that's been extremely rewarding. And what we've learned a lot, if I think can go back, 2.5, 3 years to our very first client we launched, we've learned so much since that time frame. And I think that's important. It's like every single one of these, because no cancer clinic, no oncologist is going to be the same. And so we also have to have that adaptability to ensure, because again, our goal is not to come in and disrupt the status quo and tell you exactly how to take care of your patients. Our goal is to come in, understand your workflows, understand your escalation pathways, and become that extension of that, so that we're taking work off of your plate. I'm not here to tell you how to do your job any differently or any better. I'm here to help you support your patients at scale. And so that's really what our focus is. And so every one of these implementations, we learn every patient interaction, we learn, and how do we continue to better support our patients and better support our oncology partners.
And speaking of supporting your partners, staff burnout is a real problem in healthcare, and nowhere more so than oncology. Doctors, nurses, really the entire care teams are stressed and overloaded for obvious reasons. How do you help them really breathe a little easier? What's been some of the feedback with partners?
Yeah, I'd say one of the things we do in some of our earliest conversations is I'll ask them, all right, let's take a minute, just pause and think about how many minutes, how many hours every day do you spend answering patients' questions, not in the clinic, but the ones that are calling back in or sending messages through the patient portals, answering questions, helping them, remotely through their symptoms and side effects and impacts, having questions about medication. Can I eat this? Everything, right? I just had this happen. What does that mean? If you could take, and I asked them to really think about it, and I kind of pause and give them a couple minutes to start to add some numbers up for them and their care team, right? The nurses, the APPs, everyone on the staff. And then I say, all right, what if we could take 97% of that completely off your plate? What would you do with that time? Right? What would you do with that time, right? If we can avoid some of these patients, because they do call in and you're so busy you can't get to them, they just show up unannounced, and then you have to fit them in to the clinic. If we could take that off your plate, right? That's what we do, is we say, all right, if we can take that, what would you do with that time, right? Would you be able to repurpose that at night? Because, some of that might've been pajama time, and now you can actually spend time with your family. We have one of our earliest oncology partners at Memorial Hermann. We had quotes after the first couple of months. It's I've actually gone home and had dinner with my family, a couple of times this week for the first time since I started there, right? Or this is the best program I've ever implemented since being here at Memorial Hermann. When you're hearing things like that, you realize that we're actually driving real impact, for quality of life for these providers, because we're asking so much of them. And so that's what this program is we designed it around patients, but the big part of this, a big benefit, really comes back to the treating oncologist and their care team, because we can take a large chunk of that work off of their plate and allow them to focus top of license, higher acuity patients that are there in front of them in the moment. And so that's how we really drive benefit back to the practices in many other ways, but that's a big one that we could talk about.
Yeah, and that's, of course, goes a long way towards adoption. We talk about slow adoption of health technologies in the industry. We say, well, people are slow to change, but it's really comes back to the workflow. If what you're offering could provide benefits but doesn't fit into the existing workflow, there's just more burden on the providers, more burden on the clinics. So I just love your approach. And I'm curious, once you ask them, what would they do? Well, the answer is all different, or they kind of all converged into what life used to be like when the system wasn't so overburdened. I guess maybe you can address that. But I do have another question on measurement. So measuring what matters, you gave us some figures in terms of, solving 50% of questions kind of like within the RAMI offering. What else? What other results do you track in terms of patient benefit? Do you have better patient outcomes that you can provide data for? Are you lowering costs in the way that could be measured? Are there fewer ER visits? You mentioned they might not show up to the doctor to ask a simple question, but what about ER visits and other metrics?
Yeah. Oh, we have all sorts of data. That's the best part about, healthcare these days is we got so much data. It's what do we do with it, right? How do we track it? How do we narrow in the most important things? So you did touch on some of the really impactful ones. And so avoidable ED visits is absolutely one that we track. And we've proven this with a handful of our existing clients. We also did kind of a randomizer. We took 1,000 patients last year. They're on the program at least 6 months. Across 3 different client sites, so different geographies, different client types, different cancer clinic types, and we tracked them and we looked at their ED usage during that period while they were on Reimagine Care compared to industry benchmarks, both commercial and Medicare and Medicaid benchmarks. We saw a 30% reduction overall across that entire population. For those patients that were moderately and highly engaged in the program, we actually saw a 40% reduction in ED usage. And then the most impactful one is for patients 65 and older. I mentioned earlier, highly engaged, right? So the 65 and older population over that time frame, we actually saw a 64% reduction in avoidable ED usage during that time frame. So again, you talk about really impactful outcomes. Those that's a really avoidable ED one is very important. With one of our other clients, we actually track this. Advanced cancer clinic. That's like their urgent care for their patients. They kind of built an urgent care specifically for oncology. And we've actually seen the original goal is to have 10% or less visits back to that. And we saw, that's actually around 1% right now, for the Reimagined Care population versus their historical benchmark. So again, big impact in helping to head off things. And the real reason behind that is because we're there that 24/7, right? I talked about that earlier. So patients have us at their fingertips. So when they're at a 3, 4, 5 and they start kind of interacting with us, we can course correct gently and avoid things. Whereas the status quo is a lot of patients will suffer in silence, right? We hear a lot, I don't want to bother my oncologist. I don't want to bother even if they could get in, or could get a call in, they don't want to bother. Whereas they feel a lot more comfortable interacting with Remi. So we can course correct at a 3, 4, out of 10, as opposed to them waiting at home until they're an 8 or 9 out of 10. And then all of a sudden they can't get an answer and they, Dr. Google or, urgent care. And so, or the ED. And so those are some, we're always looking to track cost reduction. And so we have a couple active data efforts right now looking to track that. Also adherence to treatment. So if you think about the same thing, if we're able to, as patients, especially on oral oncolytics, right, when they're at home, right, it's different when you have patients coming into the clinic for more regularly scheduled chemotherapy. They've got a captive audience. You got a nurse there you can kind of ask questions about. But now with a rise in oral oncolytics, we're giving them some education, we're giving them a prescription, and we're saying, okay, call us if you have problems. Well, we're there now. We can help support them. So think about, if we're able to get them their support, again, before they get to that escalation point, we're proving that we're allowing them to stay on treatment longer, which has better longer term outcomes. So program's only been live now for 3 years, but we have, longer kind of outcomes we've been tracking towards. And so year over year, we'll be able to show more and more of this. So those are a couple of the initial kind of big hitter outcomes, but, like every good digital health company, we track all sorts of KPIs internally.
Brilliant. Let's talk about AI and risk in patient care, and not specifically to Reimagine Care, but just generally AI is becoming so powerful. What happens when it makes mistakes or the wrong call or hallucinates? How do you think about accountability in this sense, and how tech is involved in critical care decisions in general?
Yeah, this is such an important question right now, Evan. It is one that the broader healthcare delivery system is having to grapple with and will continue to have to grapple with for a little bit. But I sit back and I think about this, before I come back to my thoughts on your specific question. Like if we just think 5 years ago, 10 years ago, 25 years ago, when I first started getting into this space, and if we could like have those 25-year ago us come to this place, it would like blow our minds, like what we're even talking about. So it's amazing the advancements that we've seen, and that's so exciting for the potential. But to your point, it's not perfect. It's nowhere near perfect, right? And so it's all in how we use that technology. It's all in how we set up the right guardrails. And so, I think it's really, really important. I made the comment earlier about patients will go to ChatGPT, they'll go to Grok and Claude, and they'll go to whatever their AI agent is of choice, and they're going to ask questions. It's kind of replaced. I joked earlier about Dr. Google. AI has replaced that now, and it's gotten really good, but it is a little bit scary, right? There are no guardrails when you just go ask on your own. No matter how well you prompt it, no matter how much you try and coach it, and all the input you give it, you're still going to have potential for hallucinations and other concerns. And so what we have done internally is be really rigid, right? So we're not just allowing a full, LLM, free for patients just to query at will, right? The LLM and our AI agent, Remy, it uses the artificial intelligence to really interpret and understand the patient's intent. Once we've understood that, right? So it's asking really thoughtful questions, helping to okay, now we're going to help direct the patient into one of our predefined pathways, right? So we've defined pathway ONS and NCCN guidelines on, standard pathways for cancer treatment. And so we've built those into the right pathways. And so we're using Remy to walk a patient through it. We're not allowing Remy to do full, full responses on its own, agentic AI fully. And so that's an important step. Now, what we want to be doing, like the rest of, healthcare delivery, in the coming years, is being allowed, take more and more of those guardrails off as it becomes safer and safer. But we have to walk that right line, because it is ultimately our responsibility to ensure that Remy is giving the correct answers, and not steering a patient, in a wrong course. Even if it is well-intentioned. And that's why I made the comment earlier about it's so important that you have to have the human in the loop. And that's where our VCC is such an amazing backstop, where it's that combination that is so impactful and allows us to drive a lot of the outcomes we see. There's plenty of tech-only solutions out there, but we got to be really careful with those. I think it's going to be, for a long time now, we're still always going to need a human in the loop. Even if you need fewer and fewer humans in the loop, you will still need it. And I think that's the magic balance that we've struck here with Reimagine Care.
Sounds like a good plan. So speaking of looking 5 years ahead, jumping to 2030, what do you think cancer care in general will look like? More AI-driven decisions, more personalized plans, more at-home treatments, or something completely different? Tell us.
Well, all of the above, and then some. I think everything from that's one of the biggest improvements over the last handful of years is that personalized treatment, right? Because, Irma, you made the comment earlier, cancer isn't just one condition, right? It's not a vanilla. It's not like we're doing a hip replacement here, right? Or even some other diabetes is fairly consistent, right? Whereas cancer is so many different variations of it, right? And it's a combination of diseases. And so, we can't just expect one size fits all treatments. And that's why this personalized medicine and these treatment plans is so impactful. And I'm just really excited to see this continue to evolve. And that's going to be where, the education back to the treating oncologist, because it's moving so quickly that it's hard for the clinical teams to keep up. And so I think there's going to be some really exciting advancements. There's going to have to be some exciting advancements where you're able to use AI to, in our case, we're supporting patients, but there's going to be also new opportunity, and growing moving forward, where the AI is helping the oncologist, right? Understand, okay, I've got this patient, looks like this, has this treatment on this therapy, all this other stuff. Then it's okay, now here's what we should be doing. And it's just because it's evolving so quickly, it's hard for the oncologist to keep up. So I think that's one. Certainly moving towards the ability to have treatment in the home, right? There's some infusions already happening in the home on certain scales. The REMS changes are allowing CAR T now to be happening more in an outpatient setting. I would expect at some point seeing CAR T and other therapies like that moving into the home, certainly more into the outpatient too. So I think there's going to be more of, like a lot of healthcare, right? We built this system for decades around a clinic where we expected patients to come to us, right? Mm-hmm. Whereas even longer, well before that, what happened? The doctors had their bags and they would go out into the community. Doctors would go into the home, right? That was how healthcare was delivered. We built these clinics. We asked everyone to come to us. It's now going to start reversing, and it's not going to be going fully into the home. It's the right combination. And that's going to be, I think, an important evolution over the next 5 years is, how do we all really determine, the right modality of care in the right location of care for patients, depending on all the different factors that go into it. That's where AI is going to continue to be able to help us, because it's a data challenge, right? Understanding and pattern matching and all these things. That's where I think we've got a real opportunity in the next 5 years to continue to evolve cancer care and also healthcare delivery as a whole.
Brilliant. Well, so much opportunity, and there's so many lessons to be learned from you and your experience and success. Maybe share a couple of those. We talk to so many health tech founders and physician entrepreneurs and digital health startups who are trying to change our healthcare system, and with some success, but more struggles along the way. Any lessons you learned that might help them with their journeys?
Yeah, I think there's lots of lessons. Oh man. One, I think it really comes down to the people, right? I think that's one big lesson is like, especially whether it be startup or growth stage or whatever, like the companies are constantly evolving. And so you have to make sure you've got the right people on the bus at the right time. And that's really important when you're, an early stage startup. You only have a handful of people, right? Everyone's wearing a lot of different hats. It's a different personality, different profile that's going to really excel at that stage. Those people that are amazing when it's 5, 10, 15 people, they're probably going to be bored out of their mind when it's 1,000-person company, right? And so vice versa, right? The people that, really enjoy a narrowed swim lane and like, I really get to focus on one thing and do it really well. Like, they'd be frustrated in early stage. So I think people is a big one. As companies grow, I think we tend to get a little caught up in the one team, we're going to make it all the way through, and that's not the case. And so demystifying that, I think, is extremely important. So I put people in one bucket. Another one is you have to have humility, right? When you're in healthcare in general. Like, I've seen so many very talented, well-meaning, tech-only, tech-focused, consumer-focused, all these talented people, no matter where they're from, and they enter into healthcare and they think they're going to make a difference. And that's great. But you also have to have humility and understand, like, this healthcare system is not easy to understand. There was an interesting post, and I forget who put it on. I saw on LinkedIn. It's like, all right, if someone made a comment like, I think it's easier to learn healthcare than it is to learn technology. And I'm like, okay, well, not entirely sure I agree with all of that, but like, you have to have that right balance, right? You can't come in and just like be a bull in the china shop thinking to fix everything and just seems so easy. Like, understanding how healthcare currently runs is extremely, extremely important, and understand the players. Understand that if you come in as a startup, you're going to be moving someone's cheese, right? And so if that's the case, you got to be ready for what's going to happen, right? And so what does that all look like? And so I think just, again, understanding the right combination of technology and healthcare as we're building these businesses is going to be extremely important. So those are two that kind of come to mind as far as like lessons, from building businesses.
Oh, that's great advice, Dan. And hopefully people can maybe find you online or at conferences and learn more from you directly, connect with Reimagine Care. So as we conclude here, how can people learn more and reach out?
Yeah, absolutely. So we started reimaginecare.com. We also have a presence on LinkedIn and all the other socials. And we are on the conference circuit, as you'd expect. You kind of have to be, to be able to get out there and continue to network. But honestly, the easiest way, come find me. Whether it be LinkedIn or whatever it is, just drop me a line, reach out. Would happy to connect with anyone that's trying to make an impact in healthcare. Specifically, cancer care in the next couple of years. And whether it be job seekers or whether it be people that just have really great ideas and want to make an impact. Love to network and really work with smart people to make a change.
Oh, thank you so much, Dan. Such great information and call to action here. So again, thank you so much for joining us. Great story. And thank you everyone for listening and joining and sharing and being part of this community. So with that, say goodbye.